Hey, what's up everybody? My name is Brandon Hunter. I am a board-certified pediatrician and pediatric ICU doctor. And today, again, talking about RSV and bronchiolitis. And today it's about how do doctors diagnose it. So the thing to just get started is that bronchiolitis is a clinical diagnosis. Now what does that mean? Basically, if the medical history, the signs and symptoms, and the physical exam all kind of point to bronchiolitis, then really no further testing is indicated. You don't need to do confirmatory testing and you don't need to get a chest x-ray. So what do I mean by this? Well, in terms of the medical history, usually what you hear is there's a virus going around the family and a baby gets the same virus and they've got cough, congestion, but upper respiratory symptoms. After 1 to 3 days, they now have evidence of respiratory distress and fast breathing. So the virus got up here, now moved into the lungs, and that's just very consistent with RSV or bronchiolitis in general. In terms of signs and symptoms, are they having respiratory distress? Are they breathing fast? Do they have that cough, congestion, and low-grade fevers commonly? Then that would also point to it. And then with the physical exam. So when you take your stethoscope and you listen to the lungs, what you normally hear, they're called crackles and wheezes, but they're just kind of like abnormal sounds, and they're throughout the lung fields. And this indicates that there's a virus in there that's causing issues everywhere in all the small airways. If you have a bacteria in there or a pneumonia, it usually causes issues in just one part of the lung, and it's a little bit more focused like that. And so you've got your history, the signs and symptoms, and the physical exam. If all of those sound like bronchiolitis, then you don't really need to know whether it's RSV or another virus like adenovirus or enterovirus or paraflu. It doesn't really matter. It wouldn't change your management for that patient, and so testing really isn't indicated. Okay, that said, I work in the intensive care unit, and so I'll be totally honest with you. Most kids who come to the ICU, for me, I get testing or make sure they've been tested. And why? Well, there are some times that your doctor may want to do it. So if your child's premature, they have immunodeficiency or cancer or any sort of chronic illness or high risk of a severe presentation, or if they just have a severe presentation that end up in the intensive care unit, those are reasons that doctors may want to test. So in general, if your doctor is not testing, that's probably a good sign, and it means that, hey, this is a mild case of bronchiolitis and there's no real indication. And if it's a more serious presentation, then we often will test just to confirm we know what's going on. I hope these videos are enjoyable. I make more detailed YouTube videos if you're interested in them. I'll link to those. And otherwise, the next one we're going to talk about treatment of bronchiolitis and what do you do about it.